Two-dimensional echocardiography measurements that should be made when assessing hypertrophic cardiomyopathy are measurement of the interventricular septum, measurement of the left ventricle posterior wall, and measurement of the right ventricle free wall. Note, all measurements should be made at end diastole. To measure the interventricular septum, begin by imaging in the parasternal long axis view and identify the interventricular septum separate from the right ventricular structures, such as the moderator band insertion, trabecula, and the tricuspid valve apparatus. After identifying the true interventricular septum, scroll back and forth to ensure that you can see the true interventricular septum. To measure the interventricular septum, place an electronic caliper at the interface of the compacted myocardium of the interventricular septum and extend a measurement perpendicular to the interventricular septum to the inner border of the left ventricle compacted myocardium. If an incorrect measurement is made, this may overestimate the thickness of the interventricular septum and may not truly represent the disease state or the severity of the disease. This is an example of an incorrect measurement in which the interventricular septum thickness measurement includes right ventricular structures, resulting in an overestimation of the true thickness of the interventricular septum. This image demonstrates the correct measurement of the interventricular septum in this patient, and the measurement is 23.1 millimeters. In the center image, we can see that the ventricular structures are included in the measurement of the septal thickness. This results in overestimation of the septal thickness with a measurement of 33.9 millimeters. In this third image, the heart is imaged off-axis, resulting in the left ventricle being tipped. When the interventricular septum is measured in this off-axis view, the measurement is 20.6 millimeters and underestimates the thickness of the ventricular septum. Next, we will review measurement of the posterior wall of the left ventricle. For measurement of the left ventricle posterior wall, the caliper is placed at the interface of the compacted myocardium of the left ventricle at the level just below the tips of the mitral valve leaflet, and a line of measurement is extended perpendicular to the left ventricle cavity. The measurement is made from the interface of the left ventricle and compacted myocardium to the compacted myocardium and the pericardial wall. In this example, an incorrect measurement is made, including chordae from the mitral valve. This will result in an incorrect measurement of the posterior wall and will result in an overestimation of the wall thickness. This example compares the two measurements. In this image, we can see the correct measurement of the posterior wall just below the mitral valve leaflet and not including any chordae from the mitral valve. This results in a posterior wall measurement of 12 millimeters. This is an example showing incorrect measurement of the posterior wall, and it is including chordae from the mitral valve. The measurement is 20.1 millimeters, so overestimating the thickness of the wall. Measurement of the right ventricle free wall should be made from the subcostal window in the four-chamber view. The measurement is made below the tricuspid annulus at a distance approximately the length of the anterior leaflet of the tricuspid valve when it is fully open. In addition to measuring the interventricular septum, left ventricle posterior wall, and right ventricle free wall at end diastole, it may be helpful to measure and note the site of greatest hypertrophy if it is not the basal anterior septum or posterior wall. Tips for measuring accurately. One tip for measuring the interventricular septum to ensure an accurate measurement is made is to examine the septum in the parasternal short axis view and to measure it in this view as well. One can use the two views to be able to separate the interventricular septum from the right ventricle structures. Biplane mode can also be used to identify the interventricular septum and separate the right ventricle structures from the interventricular septum. Off-axis views are also problematic for making accurate measurements. When the left ventricle is oriented more vertical in position, as seen in this image, slide the transducer closer to the sternum and move up a rib space. This maneuver will align the transducer perpendicular to the left ventricle, allowing for an accurate measurement to be made. If the parasternal short-axis view is not round in appearance, the transducer may need to be moved up a rib space for the image of the left ventricle to be on axis. Movement of the transducer up a rib space and closer to the sternum will provide an image that is on axis and will allow for an accurate measurement to be made. Another imaging tip is to use an ultrasound enhancing agent, or UEA, to assist with identification of the heart walls. UEAs can help to differentiate trabeculations and allow better visualization of the apex of the heart.